This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Next, we have the University of Arkansas. Whenever you're ready, please do share your screen and we can get started.
Hey, good evening, guys. I'm Vince Spadafrano. I'm one of the chief residents at the University of Arkansas for Medical Sciences. My co-chief, Sean Lamb, is in attendance too. He'll be helping with questions. And some of our other residents, Neil and Colby Smith, are in attendance too as well. So we'll go ahead and get started. So I think one of the things that makes our program great is the residents and the people who are a part of it. So we're very lucky to have 4 residents each year. We're a categorical program, and you can see some of our classes here. This is our most recent class down here in the bottom right. And we truly do enjoy being with each other, being goofy with each other, and working hard. And so you can always find more information about us at the link on the top left with little bios about each one of us. Our administrative staff is also super supportive and awesome. Dr. Means has been our program department chair for quite a long time. He's a pioneer in the field and was recognized at AAPM&R this past year for his achievements. Dr. Lindbergh has been our program director for as long as I've been here, and she's always super supportive and an excellent resource in TBI PM&R. Lee Austin is our residence program coordinator extraordinaire. She's always super supportive in helping us with scheduling, reminders, and being kind of like our work mom. We have an abundance of staff as well at UAMS. Dr. Kaiser here in the middle is one of our leaders in spinal cord injury here in Arkansas. We have Dr. Hunton on the top left, who likes to work with stroke rehab. I mentioned Dr. Lindbergh and Dr. Moni here on the top. They are TBI rehab doctors, and Dr. Steffens and Dr. Hobart here in the bottom right are pediatric rehab doctors who we all spend a lot of time with. Like I said, we're lucky to be a categorical program, and our PGY curriculum is built in. So you'll do a lot of off-service rotations in your intern year, but all help build on the skills you'll need in rehab medicine. And so you can see you spend a month per rotation in areas including cardiology, emergency medicine, internal medicine, geriatric medicine, neurology, orthopedics, pediatrics, rheumatology, and radiology. And we do also get a month of PM&R as well. During your intern year, you'll spend time at the Little Rock VA, Baptist Medical Center, and UAMS and Children's. So a lot of different sites. You have the opportunity to attend our didactics. It can be a little bit difficult with the busy intern schedule, but if you have time, you're always welcome to join us. And we do have some continuity clinics that you can attend during your intern year, usually during your time at on pediatrics at Arkansas Children's. Our PGY 2 through 4 years, the curriculum is split up into 4 3-month blocks each year. And so during that second, third, and fourth year, you'll spend at least 12 months on inpatient rehab, 12 months on outpatient. We do our inpatient rehab for adults at Baptist Rehab Institute, and we do our outpatient adult consults and clinics at Uams main hospital. So you will get 3 months of pediatric rehab at Children's and 3 months of outpatient pediatric rehab as well at Children's. You'll see things at BRI. We have 3 different services right now. One primarily sees stroke rehab, one TBI and brain disorders, one spinal cord injury, and there's also one that sees kind of general rehab inpatient patients. We do our EMG rotation and our interventional pain rotations at the Little Rock VA, and so we spend some time at that site as well. This is a picture of Uams Hospital. Like I said, we do our outpatient clinics and consults at Uams. We are lucky to have our clinic on the second floor of the Jackson T Spine Center. It's a really awesome facility. But we also do go out to different satellite clinics in the community around the city, including an orthopedic clinic at Colonel Glenn. You will spend some time at Uams anesthesia and interventional pain clinics as well. That's on the first floor of the spine building. And then you'll see consults, wide variety of anything from strokes, spinal cord, TBIs at the main hospital as well. We do have the opportunity to go to some community clinics as well to see some interventional pain medicine and regenerative pain medicine with PRP in the community with some of our affiliate staff. We spend our adult inpatient rehab at the Baptist Health Rehabilitation Institute. So it's the state, Arkansas's most experienced PM&R hospital. It's the largest comprehensive facility in the state. It's about 60 beds, and it's the only Arkansas facility certified in brain injury, spinal cord injury, and amputee medicine rehab from the Commission on the Accreditation of Rehab Facilities, or CARF. So really great hospital, has a ton of equipment. You can see our locum mat down here on the bottom right. No shortage of equipment, excellent therapists. It's really a good place to do your training. I did mention we do our pediatric rotations at Arkansas Children's Hospital, both 3 months of inpatient on a 12-bed unit and 3 months of outpatient in the clinic as well. It's pretty awesome because they have multiple multidisciplinary clinics available for spinal cord injuries, muscular dystrophies, and spasticity management. So you'll get Botox exposure here, EMG exposure on pediatrics as well. We do have some community outreach clinics across the state that you'll have an opportunity to go to and participate in during your time as well. I mentioned the Central Arkansas VA Hospital. You'll spend a lot of time there as a PGY1 intern with us on your cardiology, geriatrics, and medicine months. You'll also be there later on in your PGY2, 3 or 4 years when you're doing EMGs or our interventional pain rotation. It's nice because while we're there, we don't have to take call at our rehab hospital. So it's a nice break and good exposure to those EMG and interventional pain fields. One thing that really helps set us apart, I think, is our mentor groups. That we have a mentor group which consists of 1 resident per PGY level and 2 faculty. And every once in a while, at least quarterly, if not more often, you'll meet together as a group to discuss opportunities for research, quality improvement projects. And so it can be a really great way to get involved with research through these mentor groups. But they don't just do research, they help facilitate some of the presentations you have to do as a resident throughout the year, including journal club, M&M, case reviews, lectures during anatomy block, and other educational activities. And so you can help submit your presentations beforehand, get feedback from your mentor groups on those. It's also a great way to get guidance and career guidance from your upper levels and faculty in the future. So really, their mentor groups is there for any questions you might have. And then, of course, Arkansas's nickname is the natural state. So if you love the outdoors, there's no shortage of things to do. The top left picture is actually taken from our 7th floor department out at the Spine Center. Some people call us Tree City, USA, because of all the green areas. And then there's lots of hiking, camping, fishing, tubing, anything that you would want to do outdoors, as well as downtown Little Rock has restaurants, bars, and we have a minor league baseball team. So no shortage of things to do for fun in Little Rock as well. And here's us participating in some activities as residents. We had yard games. We typically have at least one social activity, one big social activity a quarter, try to get residents together for a wellness activity. And you can see us participating in yard games there. So I think that's the presentation that I have. We can open up the floor to questions now. If anybody can feel free to chime in. Sean, maybe you can answer that question.
So hopefully you guys can hear me. I'm Sean. I'm the co-chief of the program. So there's a good number of, I would say maybe 33% of our faculty members that are DOs, and some of them do encourage and incorporate OMT into their practice. We have a private doc that we work with that Vince mentioned that does regenerative medicine, and he does OMT frequently into his MSK ultrasound EMG clinic. So, and then if you want to, there's opportunity to kind of seek that out and learn about how it works with billing, how it kind of, you can fit it into your practice seamlessly, and go forward from there. But it's not anything set in stone. Like, it's not part of the curriculum, obviously, but there is opportunities. Yeah.
And yeah, as far as our anatomy blocks go, every year we have a dedicated anatomy block of didactics, and that includes in-person lectures, guest speakers, and time in the cadaver lab, looking at prospective cadavers. So very hands-on.
Yeah, I can answer Maggie's question. So yeah, it's an in-house call schedule. We take call only at Baptist, the inpatient unit that we work on. So it's in-house. It's split evenly amongst all of us. So it works out to be about 3 days a month. And usually it'll be like 1 Friday, 1 Saturday, 1 Sunday every 3 months, or 4 per year. So it's not bad at all. And you get a guaranteed day off the next day. And frequently, since our rehab census is on the smaller end, it's not uncommon to have a good call night. I'll just say that. And then what percentage of residents go on? I would say, I can answer the question where the past 3 classes have ended up. I think that'll be a better indicator. So the farthest class that graduated, from my knowledge, one went into sports medicine in NYU. One ended up here as a faculty member. One's doing inpatient, and the other one's doing an inpatient outpatient mix. the class below them, two of them went into pain fellowships. I think one's UC San Diego and the other one was somewhere in Virginia. One went straight into general MSK outpatient ultrasound EMG clinic, and then one went into inpatient outpatient mix. And then the class that just graduated, none of them pursued a fellowship. They all went straight into practice for various fields. But since, like Vince mentioned in the past, pediatrics is actually a pretty big component of our program. So there is usually one or two per class that is interested in it at the very least. So a decent variety.
So we do have good opportunities for sports coverage. We work with Dr. Cassatt, who's a sports medicine doctor, and he provides coverage for the Little Rock Marathon every year. You have opportunities to help volunteer with local football, high school football throughout the year if you're interested. But we do pre-performance sports physicals with some local schools as well. So there's coverage as well.
We have about 5 minutes left.
Sure. Let's see. Is there an elective rotation available for prosthetics? There's not a set rotation that's only for P&O, prosthetics and orthotics, but we have a monthly amputee clinic with one of our attendings who specializes in it. And like Vince kind of mentioned before, that BRI is one of the, it's the only accredited inpatient rehab facility for amputees. So we get a large volume during our inpatient months to kind of see that patient population. So I guess, yeah, you could have it would be nice to have an elective rotation, but the amount of volume that we get, I don't really think it's necessary, so to speak.
Hey, it's Colby here. I'm a PGY3. Also, along with the P&O clinic that Sean was mentioning, the vendors are also there during the clinic, so you get the education from that perspective as well. And then at our extensive VA exposure, we have a little bit of P&O exposure there as well.
As far as international electives or associations, you're welcome to join any associations you like. I don't think our program is pretty busy, so we don't have a lot of opportunities for electives. You see a lot of the core curriculum built in. I don't know, Sean, if you have any other comments.
No, so I think we join all the associations like AMA, AAP, APM&R by default. And like last year, we went to AAPM&R, and there's no shortage of research cases, publications. Faculty are very supportive of that and often encourage it, but it's not mandatory. Besides the one scholarly activity you have to do, no matter where you go. But yeah.
So, also, I will chime in. I see this question from Maggie about the multiple institutions. I know it can sound like we're going to a lot of places when we're talking about going to UAMS, Baptist, the VA, Arkansas Children's, but unlike a lot of places, all of these facilities are within a 10-minute drive of one another. They're all very close. I mean, Little Rock is not a huge town, so it just sounds like you may have a lot of travel, but in fact they're all very short. But one of the benefits you have from going to all of these places, as well as just Little Rock in general, is even though Little Rock is a smaller town, you're getting all of the pathologies from the state of Arkansas. So even though the town is 250,000 people, you're collecting a patient population of I don't know, 2.5 million, whatever that is, that are coming to all of these specialty hospitals. So even though you're in a smaller area, you're getting the exposure that a larger area may get. I don't know if that completely answers the question, but
to piggyback on what Colby's saying, I think it's nice to be able to see multiple different practice settings. So you get the VA system, you get a children's hospital, you get a private hospital, you get a community hospital, state hospital. So you get to see different systems of practices of medicine. I think it's helpful. And we do spend significant chunks at each one. So at any time, you'll spend at least 3 months at a site. And so you'll spend a year at Baptist Rehab, you'll spend 6 months at Children's, you'll spend at least 6 months at the VA. So you get big chunks of time in each one. So, and another thing is all these sites outside of the VA all use Epic EMR. So to be able to share information is pretty accessible as well.
Awesome. Thank you so much. University of Arkansas